When a child is sick, you want the best care close to home and for them to get better as quickly as possible. OSF Children's Hospital of Illinois has been growing as the place for whatever a child and their family needs for decades. And some exciting changes are on the horizon.
We are so lucky to be able to provide these services and to be here. It's truly an honor. So when you choose Children's Hospital of Illinois, we will love your family and your children just like they're our own. And we can't do it without the support from our community and from our philanthropic pieces as well. It's so important for that sustainability, but we're honored to be here. We're excited where we are, but we're really excited about where we're going.
That's Meg Zakrzewski, president of OSF HealthCare Children's Hospital of Illinois, and I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. OSF HealthCare Children's Hospital of Illinois is the third largest pediatric hospital in Illinois and the most comprehensive hospital for kids downstate. With 136 beds and more than 140 pediatric subspecialists, OSF Children's Hospital cares for more children in Illinois than any hospital outside of Chicago. Formally established as a pediatric hospital within the walls of OSF St. Francis Medical Center, in 1990, OSF Children's Hospital of Illinois has more than 7,000 admissions, 2,500 newborn deliveries, and 18,000 emergency department visits each year. Inpatient beds moved into a new home in 2010, but it's time to expand once again because the needs continue to grow. Joining me to talk about the exciting changes on the horizon are Meg Zakrzewski, president of Children's Hospital of Illinois, and John Heller, who, along with his wife Annette, established the Heller Center for Kids at OSF Children's Hospital of Illinois. So, first of all, thank you to both of you for being with me. Meg, let's start with you. How have we gotten to this point? And why the need for the expansion and what's going to happen?
Yes, we are so excited to be in this next phase here at OSF HealthCare Children's Hospital of Illinois. And we have outgrown our walls, particularly in our outpatient center. So we do 71,000 outpatient visits a year, and it's growing every single year. And with that, we have the opportunity to create a new space that is uniquely pediatrics, that feels pediatrics and really focuses on that family-centered care. And that will include our specialty services and surgical services, a part of our destination care model.
Yeah, because right now it's a little disjointed around the campus. If you come into Peoria, there's various places. And sometimes people think of everything that happens at Children's Hospital within the inpatient space, and there's plenty of it. We provide a lot of care, as you said, outpatient-wise. Tell us about some of the subspecialties, because I don't think sometimes people realize everything that is offered.
Yeah, certainly. We have 40 subspecialties. So everything that you can think of, from urology to nephrology, GI, surgery, orthopedics, all of those specialties are a part of Children's Hospital of Illinois, and now we have an opportunity to have most of them under one roof. So we're really excited about that, so families aren't traveling to multiple places to receive the care. That could be hard. We recognize kids are pulled out of school and parents are missing work, so we want to make it the easiest experience possible.
Yeah, and I think sometimes people don't realize you can come to Peoria, central part of the state, and we pull in from a pretty wide coverage area, don't we?
We do, yes. We have a huge coverage area. So there's 1 million children outside of Chicago. That's a lot of children that need preventative care, but also specialty services. So expanding this footprint and making sure we're meeting families where they're at with their needs is an important part of destination care.
Yeah, because sometimes it can be a little overwhelming going into the big cities, if you will, where Peoria is a little more family-friendly, and there's a lot offered here. And ease of access, you've already touched on that.
Ease of access. You know, we love our commute in Peoria. You really can get anywhere in 20 minutes.
Yes.
And that is a wonderful part of our city. We have such a kind community and a wonderful organization, and really pulling it together and making it easy, really creating an experience that's different than anything that we've had before with technology and driving home the aspects that families are asking for right now for care.
We also support the rural communities around because, you know, downstate Illinois has quite a few. And even that model of care has changed over the years just because of what you have to do. But kids still get sick in those communities, and they come in. And I think some of what is offered in Peoria is kind of a comfort zone for them, don't you?
I completely agree. Being able to have your specialist wherever you are, we do have 10 clinics across both of our eastern and western and southern regions. So those outreach clinics with all of those specialties that I listed before, so we have 10 of those in addition to everyone located here centrally. So that access and meeting families where they are is a key part of our care.
Yeah, so we're going to them and making it easy.
We are.
So before I turn to John's sitting here listening patiently to all of this, but I want to touch on the space that the new pediatric subspecialty services will be going into. People who have an awareness of the OSF St. Francis Medical Center campus. It's been about, 5 years ago now, 3 years ago, we moved out of what used to be ministry headquarters for OSF on Northeast Glen Oak Avenue. It's that darker brown building with kind of a circular part of the front and the driveway. And that's where we're going to be moving into. We're repurposing old space, aren't we?
We are. We're repurposing old space that will be uniquely pediatrics, though. And it feels and it looks like what pediatrics should feel and look like. So when you walk in, it will be open and fresh with a lot of light, a lot of area for kids to move around. We will have an outdoor play area that will really be a wonderful spot if you need a break during a clinic visit, or if you have a couple of kids and maybe one's getting a little rambunctious in the room. So there's that opportunity there for that as well. But we will have procedural spaces too for children that need that in that outpatient setting and they don't need to be in the hospital. You can get your x-ray there, so you don't have to leave. You can get your x-ray right there, and labs will be done there as well. So really consolidating those areas of care in one roof and making it easier for our families.
Let's talk about a timeline on that. I know we're almost at the end of the design phase.
We are. So we're concluding the design phase. We will be breaking some walls in 2026, so excited about that. And then we're moving in to our new home in 2027.
Which it will move quickly, honestly. We all know how that goes. It seems like that sounds like a long time from now, but it probably won't be at all.
It will go by so fast.
All right, let's turn and loop in John Heller. So I can't believe this, John. It's been almost a decade since we first started talking about, at the time, what was the Heller Center for Kids with Cancer, established by you and your wife, Annette. And we are transitioning to the Heller Center for Kids at Children's Hospital of Illinois, which is so exciting. So let's start with a recap of the journey of what the idea and goal was and how we've gotten to today, and the fact that it's almost 10 years in, and I can't believe that.
Yeah, we have to stop and think about that because it doesn't seem possible, and it's been 10 years. Yeah. The goal and the vision was pretty simple. We looked at, there was a lot of services that Meg's talked about, providing all the medical things for the kids. But then there was this awareness and reality check that wasn't everything that made them whole, like made them well. To the sisters' mission statement with, taking care of mind, body, and soul. That's wonderful. We were doing really good with the body, but then to keep these kids' spirit healthy. And so we were looking for something that was very different and providing these services that surround things like diet, physical, mental health, education, all those things that the normal medical things don't deal with. Right. Was really important to us to make sure that we were giving these kids a chance to thrive after they went through their diagnosis or whatever. We wanted to start with a scope that we knew we could manage, so we started with pediatric cancer. But the whole time we were doing that, we were very hopeful because we all recognized there's kids with a lot of other challenges besides pediatric cancer. We want to take care of those just as well. So to feel the contagious passion that Meg's bringing to the table with this to move this thing forward and get this focus is pretty special for us to know that we're now providing these services to all the kids. I'm a one or two liner, 3 or 4 words. When we first met Meg, she said every kid deserves joy, and I thought that's pretty special. If we can truly live that mission that every child deserves joy, then we ought to get after that. And I think it's an opportunity for us to make an appeal to the larger community that you ladies have been talking about, the OSF footprint, if you will. We just have to do better for all the kids, and we want those services available to each and every one of them that walk through that door.
Yeah, because these kids grow up and they go on to lead adult lives. And we even offer programs that transition them from the pediatric, kids with congenital heart. You have specific physicians who help treat that through this, but they have other things they face, whether, say, it's in school. You mentioned it before. These kids sometimes miss lots of school.
They do.
Because of their health. So how do we help them not miss more steps along the way? And there's lots of stories about how we've helped that, aren't there?
There are, absolutely. That's probably the most rewarding part for Annette and myself. And we have a fairly large community contingency here that are with us on this Heller Center for Services. So I never want to understate how important that is, the people that have joined us on this journey. And I think with this expansion to the entire Children's Hospital, that's going to gather even more engagement from the community. And we got to tell our story. We got to say it out loud, whatever it is.
And I know John is never at a loss for stories, but along the way, there have been stories that have stuck with you, haven't there, of young kids. So could you share just one, or that just is always in the back of your mind, or maybe the front of your mind, honestly?
Yeah, this is especially sensitive for me because Annette and I just returned from Mexico, and it was a young Hispanic boy that we met in the Children's Hospital, and he looked at us and said, "You saved my life." Like, pretty heavy for Annette and I to think that this young man is giving us credit for saving his life. And the story was simply that he had been diagnosed with cancer at the same time his mother had been diagnosed with cancer. And his solution to the problem was he was going to take his own life because the family couldn't handle 2 cancer patients at the same time. And the fact that we had those psychosocial services available for him at that point in time, we were able to deal with that immediately, because it's another critical component to these services. Sometimes these services can't wait. You get one opportunity to deal with them, and if you're not dealing with them maybe in that first 10 minutes, that first hour, the first day, you lose that opportunity. So
Wow.
I still see his face.
There's so many psychosocial. I feel like that's a good portion of what we deal with, because imagine the stress. This young man felt responsible for that.
Yes.
That no child should have to feel responsible in that manner. So the fact that services such as those offered through the Heller Center for Kids are there. Do you see it, Meg, on a daily basis and hear the stories and hear from the families? Because you're in the space every day. You probably hear it more.
Absolutely. Every day there's an impact on what we're doing in the care we're delivering, but especially the aspects of the psychosocial care that Heller Center for Children at Children's Hospital of Illinois is helping us bridge that gap. So we're truly treating these kids' mind, body, spirit. And Heller Center is a huge component of that, as is everyone that has helped us get to this point over the past decade. So seeing the kids and hearing the stories and really helping them through that journey through one of the most challenging times where they receive the diagnosis, especially at an age where they really understand. They understand the impact that it has on their family and themselves, and then they're missing out on key components that normal kids that don't have to have all of these visits, or kids that don't have that diagnosis, they don't have to have all of these visits. School and dances and football games and baseball games, oftentimes they're in the hospital. So bridging that gap and allowing them to have someone to talk to. Also, our creative therapies program has been a large part of Heller Center for Kids at Children's Hospital. So that includes music therapy, our child life specialists who are phenomenal, and it's truly therapeutic and healing. And oftentimes with music therapy and child life, we could avoid medications where they need to go to sleep for procedures and minor things as well. So truly it is HealthCare, and it is destination care.
Yeah, because sometimes there are things kids don't know they need when they need them. Yeah. Diet. Every kid just wants to eat the hamburger and, the easy stuff from the fast food joint. But sometimes there's things that can help their diagnosis. We have those people in place. And again, just somebody to talk to who's not their immediate family. I'm guessing sometimes it's just that other component that is huge. So, John, and I know if Annette was sitting here, she would answer this as well. Has this exceeded your wildest expectations? I know a decade ago, I can remember the initial conversations, but you put it on paper, you go, okay, this is going to do this. Has it gone that way, or has it just blown the expectations out of the water?
It's definitely blown the expectations out of the water. You know, when we started, because when Annette and I decided to make this gift, I've worked at Caterpillar for 38 years, so we were used to driving outcomes, and we were very concerned about how do we know that these services are delivering what we want, because as we were out, pleading the community to move with us on this, you're oftentimes dealing with people that are used to delivering things and outcomes as well. And Choi was very, very agreeable to defining a set of metrics. So that's when you measure things, they get done. We were doing that across these services. We knew where we were starting with these defined set of services, that monies were available to deliver. As more monies were available, more services got delivered, and you just see that cascading start to happen. And then when we were able to have the conversation, it says not just kids with cancer, but every child. And that became like,
it's a good feeling. Yeah. That's a good way to go.
Bigger than we ever thought.
Yeah.
So.
And if people want to support that, because obviously we want support. So the OSF Foundation is the keeper of all things. It rounds it all up, so they're easy to find, and they can certainly connect with helping with the Heller Center and the fundraising, or just the support in other ways that we need.
Yes.
Yes. So as you look at this, and Meg, I'll direct this to you, all of this work, does that help even put more of that focus on OSF Children's Hospital of Illinois being a destination center for pediatric care?
Absolutely. So we are the third largest children's hospital in the state of Illinois. We have been providing specialty care for pediatrics for over 40 years. So really the creation of the destination center has been there, and we're continuing to grow and add those necessary services that these children and families need from their community. And we are a community that truly loves, and we care about each other here in Peoria. We're very, we have a lot of Peoria pride, and Heller Center is such a huge component of that as well. And everyone that has helped to build and grow and contribute to it, we're so thankful.
Yeah, we're kind of at that time of the year, the thankfulness and the thinking of families. And so this is just such a perfect topic. And I know the two of you are extremely passionate about this work. What is the one takeaway that you hope people who are listening and watching get from this? What is that takeaway you hope they're hearing?
I think just the importance that of the role that Children's Hospital plays for Peoria, downstate Illinois, for the Midwest, for whatever our reach is, that we've got something really special. And we need to kind of start shouting it from the rooftop rather than being a little bit, the sisters are very humble.
Yeah.
We execute the mission in a very humble way. And I think with a little less humility and a little more pride might do something really special to help Meg and her team deliver these services in a really big way for everybody involved, for every child that walks through that door.
Yeah. We are so lucky to be able to provide these services and to be here. It's truly an honor. So when you choose Children's Hospital of Illinois, we will love your family and your children just like they're our own. And we can't do it without the support from our community and from our philanthropic pieces as well. It's so important for that sustainability. But we're honored to be here. We're excited where we are, but we're really excited about where we're going. We're excited about the next 10 years in destination care.
I'm excited to see that new facility, too. It's going to be. I've seen some of the preliminary drawings. They're super cool. Meg Zakrzewski, John Heller, thank you so much for sharing your passion with all of us and being here.
Thank you.
Thank you.
And thank you for joining us as well. And remember, you can catch all episodes of OSF Healthcare Accelerated at osfhealthcare.org/accelerated.